Have you worked with someone who is centrally sensitized? Can they recover from pudendal neuralgia? So, yes, and I'm so sorry you developed central sensitization. It is this memory of pain in the central nervous system. This is the best explanation that I have. And a lot of patients, when they have prolonged neuropathic pain, they become centrally sensitized. One of the ways to address central sensitization is to block the nerve for long enough for this process to reverse. And I use either the pain pump that the interventional radiologist places during the CT procedure, which I have previously discussed, and I also use the same pain pump during the decompression surgery. So the key here is to block the nerve for long enough. I'm also a great believer in ketamine. I don't myself do infusions of ketamine, but I very much am in favor of patients getting them done. I do use suppositories, both vaginal and rectal, that contain ketamine, and my patients use those 2 or 3 times a day, and therefore they have this prolonged infusion or use of ketamine, which is very helpful or may be very helpful in reversing central sensitization.